maternal mortality was 20 out of 100,000 births in 2019. In 2021, it went up to 30. So it's not just a statistic, right? This is over 1,000 families who've lost a really central part of their family, a child who doesn't have a mother.
What is the biggest misconception about maternal mortality in the U.S. that healthcare leaders still don't fully understand?
I think people don't fully understand that a lot of it is.
Leah Sparks is the CEO of Wildflower, a company she founded in 2012 while pregnant with her first child to fix one of the most broken systems in America, maternal health care.
Your health is not just what happens with your blood pressure readings in your labs. It is everything going on in your life will impact your ability to have good health, and in this case, with pregnancy, good outcomes.
What she's building might be the reason a mother survives. What are the top 3 maternal risks you're most focused on catching earlier?
Number 1, mental health. Number 2, blood pressure. And the third one are what we call social determinants. Those all really impact your ability to have a healthy pregnancy.
What should every American know about maternal health in this country?
Great question. So
Yeah, be here. Yay, here we go. Oh my goodness. For those who don't know who you are, in 60 seconds, can you introduce yourself to the audience and what you do?
of course. Well, I'm obviously Leah Sparks, CEO of Wildflower, mom, friend of Karina, avid Zumba dancer. And, I think what I really am at my heart is a builder and someone who is trying to solve problems in a pragmatic way. And today that takes the form of running a company that is working to make maternal health care radically better in the United States.
And thank goodness that you are. Thank you. Can't wait to share more about what you're doing with everyone. You're leading a company where decisions have life or death consequences. What is your mental edge so you can consistently show up and solve problems when the stakes are this high?
Yeah, one thing I do every single day is start my day really trying to make sure I have perspective. I think it's easy when you're in a role where you're leading people and you're trying to solve big problems to both underestimate your power and overestimate your importance. And so, really trying to stay focused on what you can do every day to move things forward is kind of how you keep your mental sanity, and really appreciating things you can control and the things that you can't. And kind of like how you eat an elephant, you take it one step at a time, one bite at a time, and that's really, I think, how I approach things and try to keep my feet on the ground.
I love that. What breaks first when you don't do this? Clarity, empathy, or speed?
Um, I think the first thing that breaks is definitely clarity, at least for me. In some ways, if you're not grounded, you have a tendency to go too fast, which just speaks to your speed, or you have a tendency, maybe in some ways, even be over empathetic, right? You can't make good decisions if you're not really grounded and keeping that mental acuity of thinking in a way that is, yeah, of always being empathetic, always want to do things quickly, but realizing again that we have to take things one step at a time and appreciate the wins we make every day. That's the only way a journey can be sustainable, right? If you're trying to push yourself too hard, to do too much, or get too emotional about it, you burn out. And so that's why I think the important thing to staying grounded is making sure you keep that high quality decision making and really appreciating what you can get done in a day and what you can't.
Yeah, I'm in awe that you can, and I'm in awe of you being able to stay focused on what you're doing and keep this light that you have of energy to solve these seemingly impossible challenges within the healthcare system and for women in maternal health. So I'm just I mean, those are great tips for anyone in life, I think.
Mhm.
But given the pressure to make a company be both profitable and effective and really save lives, that's a lot.
Yeah, I would say though, it's also a source of energy, right? When you do things that you love and that you believe are important, it is why, I mean, I've been on this journey with Wildflower since 2012, right? When I was pregnant with my first child and wanted to make this whole system work better for expecting parents. And when you work on something you believe in, even if it's hard and tiring sometimes, it's the source of energy and the source of purpose. So I think those things really come together.
So, mission driven careers give you fuel to, like jet fuel, to um, be grounded and have, engage with your edge in a way that is fruitful,
Hmm.
it sounds like.
Hmm.
Because that's not everyone's perspective. I think it's a beautiful way to look at life. And it would be impressive even for someone who wasn't taking on everything that you're doing.
Yeah. And look, it's just what motivates me. Everyone's motivated differently, right? And so that's just for me, that's what works. And lots of ways to contribute, but this is what motivates me.
I love it that you are doing this. I'm so grateful. For someone who's never heard of Wildflower, what is the simplest way to describe what you do and what changes for a mother because you exist?
The simplest way to think about Wildflower is filling in the gaps when people are before, during, and after pregnancy. And what I mean the gaps is that, and this is true not just of pregnancy, but a lot of the healthcare system. We have these very expensive and focused clinical touch points when you go to the doctor, when you get a surgery, when you deliver a baby. But over a pregnancy, it's a year-long period. You have 40 weeks of the pregnancy, at least 3 months that are really impactful after you have the baby, but you're in the healthcare system maybe 15 times. All of those other days in between, those 365 days, what's happening? And so Wildflower creates a technical extension of the healthcare system, a human extension of the healthcare system, where your non-clinical needs can be met. So your life stressors, your mental health, monitoring for things that can change clinically. So you go back to the healthcare system when you need to. And it's that concentric circles that we surround the healthcare system with that is what Wildflower really is. We're not replacing the doctors and nurses, we're extending them and helping them take care of patients when they're not in the office, using technology, predictive data, as well as humans who are available virtually and in person based on what we do. Does that make sense?
Yes, that does. And thank you again. I'm just so appreciative. What was happening to mothers before Wildflower? So I get that you're speaking to the value that you're adding, and like, what did that look like?
Yeah, I'll give you great examples. So doctors and OB-GYN offices are required and should screen every pregnant patient during pregnancy and after pregnancy for mental health. What happens is people have a score in mental health, and if it's obviously very high risk of self-harm, there's immediate intervention, but there's a lot of people in between who need help. And the way our healthcare system is structured, then doctors and nurses don't often know where to send someone. So that's a perfect example where someone can fall through the cracks and something that's maybe a modest issue, I'm anxious about childcare or I can't get off of my job, can spiral into an issue that becomes very dangerous for that pregnant patient. So that's an example where they hand the patient to Wildflower, we help coordinate that. Or another example, patients show up, especially low-income patients, maybe they can't get transportation. Maybe they need help with rental assistance. Our healthcare system is not poised to do that. So those patients go off trying to navigate the bureaucracies on their own. Those OB-GYNs and nurses can hand them to Wildflower. We coordinate all of that for the patient. So that's what I mean by all the things that impact your ability to have good health. In this case, it's zoomed in on pregnancy. Wildflower is an extension of that to really, we call it whole person healthcare, realizing your health is not just what happens with your blood pressure readings and your labs. It is everything going on in your life will impact your ability to have good health. And in this case, with pregnancy, good outcomes. A lot of people in my space believe that 80% of outcomes are really driven by these other factors, not just the things that are in the healthcare system.
That makes sense. I mean, if you can't drive to an appointment,
You're not gonna get care.
okay, that's a big 80. It's an easy percentage. It's a big percentage of why that's not going to work out
Mhm.
if you can't even show up.
Mhm.
So I just think it's fascinating how on earth does Wildflower fill in that gap
Mhm.
where the healthcare system can't.
The healthcare system does not pay our clinicians to do this work. It is, I mean, it's, you don't want your doctor who spent 8 years in medical school and everything else coordinating a bus pass. But Wildflower, because again, we use technology, we hook right into the doctor's office's workflows. We have our health advocacy team, we call them. They're not nurses, they're not doctors, but they are people trained to work with our patients to solve these problems, but in a way that's very efficient because we're using technology, we're using AI where appropriate, which I know we'll talk about at some point, and really trying to create very efficient ways and low cost ways to close these gaps and get the patients what they need.
That's precisely what they are. Is there gaps that seem incredibly inefficient that they exist, and of course, doctors can't make that
Right.
call to give someone a bus pass. And how brilliant that you have devised and conceived of a way for women to be supported and actually have these areas that are just, it's almost, it's heartbreaking that this could be an area that is not addressed, or that could be the reason that somebody doesn't get the care that they need, that they can't actually show up to the appointment. Because in some cases, it sounds like the cost isn't even that high. Like it's a bus pass or.
Well, that's exactly, or it's free through the state or free through the county. It's just helping people navigate it. And I think what's also, I think an important point is that the work that we're doing, the reason we're not a nonprofit, right? We're a for-profit business. The reason we can do this work is because it does pay for itself. Like we work with various insurance companies, people who pay for healthcare, including Medicaid, which are low-income healthcare, who pay for our services because it's proven that when you have you have this support and this navigation, you have a healthier birth, which is also lower cost, which matters to all of us, including taxpayers, right? And it's better for families. So it is a high value thing that we just have, I think that's been the promise of technology in healthcare. And now AI hopefully has even more promise that we can actually use it in this way and not just in pregnancy, but across the board. And we're still, I think, early in that journey as an industry, but that is really what, I started this in 2012. Mobile health was a new thing and it was supposed to solve these challenges. And we're still chipping away at it, as in the United States, but that is what we should be doing.
Well, this term mobile health, what exactly, when you say it, it sounds like you know what you mean, and I'm not clear on what is mobile health.
To me, it's using our technology to help us go into the home with patients. I mean, look, this is like, like once we started having these little computers we carry on our pocket or wearables on our arms, now remote blood pressuring cuffs, remote, all kinds of remote monitors, there's much more signals and data you can get from patients in the home. AI is going to take that further. And that to me is what mobile health should be. It extends the healthcare system, which is very antiquated and that you have to trot in person and get everything done there. It should extend the healthcare system so that for people with especially distinct healthcare needs can basically track their health in the home and have a way to then have it be connected back to in-person care when they need it. So that's what I think of mobile health broadly. It's not just like mobile apps and tracking. It's all the technology ecosystem we can put together to better monitor and predict risk in patients and then get them connected.
Beautiful. Okay, just to clarify, yeah, because it's not like mobile health is the ambulance because it's mobile and it's in a car, it's a vehicle.
No.
Yeah, it's like you are a web of just bringing all of these different technologies and services and apps and all this knowledge and awareness and all of these services into an ecosystem where people can resource them. I use them as a resource and benefit from them with this patient care provider that is like their their guide, their Sherpa through pregnancy to blissful babies coming out in a healthy way, and everyone wins. So I love it because it's such a win on a win on a win. Like the insurance companies are winning, it's a profit. So that means everyone's incentivized that this is a win across the board, but it also means that there's a more likelihood of it staying. It has more staying power because it's not reliant then just on like taxpayer dollars. So I feel like that's another area that it just is genius and gives me great comfort to know that it exists, because I feel like, you know, the way I've been brought up with in the American system with healthcare is it's greatly dependent on the government's whims or how the country is voting at the time. And this is independent of also politics. So how beautiful that it could be a more stable, more consistent, more safe reality for women to feel comfort in that they're, when they have a baby, which is kind of a big deal for society, that babies get born and that they live.
Yes.
We kind of want that for everyone.
Yes.
So what a great thing. And thank you for what you're doing. It means a lot to me that you use all of your knowledge in this space. I know it gives you joy, but obviously there's a lot of other places you could be making more money potentially with this wisdom and this talent that you have. And so it's a big gift to everyone. Where were women falling through the cracks the most that you've helped and changed lives?
Yeah, I mean, again, I think the most people that we have helped, now I'm going to answer this two ways. The most people we've helped is on, as I mentioned, mental health issues. That's our number one issue that we help navigate. And then life issues, right? Social issues, right? Whether it's transportation, community resources, rental assistance. But I would say one of the most important things we do that might be the most impactful is because we are an extension of clinical care. We're monitoring for blood pressure spikes. We're monitoring for signs and symptoms of infection and the things that lead to maternal death. We're monitoring for risk of self-harm. 10 to 15% of the patients that we work with, we find a risk in between visits that might have gone undetected, and we get that patient to clinical care immediately. And to me, while it's, only 10 to 15%, that's, on our platform, that ends up being thousands and thousands of patients that, that's what really gives me hope that we can begin to move the needle on maternal deaths, on really, really bad complications, because it's finding those risks early and getting people help that they need clinical help. My navigators aren't going to do it, but getting them back to their OB-GYN or the ER or the hospital, that is really, really important and something that I take very seriously. And it means we have to be, covering 24/7, making sure we're there for patients, because that is where I feel people can really fall through the cracks in the U.S. healthcare system.
When you say reducing avoidable harm, what does that actually mean in real life for a family?
Well, then this is something we talk about a lot in our company is, we talk about maternal mortality, right? Maternal mortality was 20 out of 100,000 births in 2019. In 2021, it went up to 30 in 100,000. That translates into over 1,000 women a year who you lose their life due to childbirth or somewhere along the pregnancy journey or postpartum. And so it's not just a statistic, right? This is over 1,000 families who've lost a really central part of their family, a child who doesn't have a mother. And then on top of that, there are over 50,000 women a year during pregnancy have a very severe complication that can compromise their ability to, thrive in a healthy way in this vulnerable period of having a newborn. So the point is that's what I mean by reducing avoidable harm. We have the highest rate of maternal mortality compared to other OECD countries, in some cases twice the rate, and we can do better. And these are not just statistics. These are families These are people losing their lives. It's a mother who is not there to take care of her kids or kid. And so that's to me, that's the goal, right? Is to continue to bring that down. And then everything in between, right? Just people having a great experience and feeling great after they have a baby is also reducing harm, right? And not having anxiety or depression. The problem has gotten worse. We know we can do better. We know that some of the things that we're even doing at Wildflower have reduced rates of severe complications, right? So we know we have to figure out how to scale these strategies in the U.S. healthcare system.
The distinction between, I'm just, there's a lot of stats there. The distinction between basically the certain amount of death during childbirth is real.
Preventable, yeah.
It's preventable, and a certain amount isn't preventable, right? So out of those stats, what percentage of that is guaranteed preventable? Is a standard, everybody agrees that it's preventable?
I mean, I'm not a clinician, but clinicians would tell you up to half of the maternal deaths in this country could be prevented.
That's what I was getting at. Thank you for helping me to clarify, because I know it's hard. There's a lot of different points of view on where it's at, but that sounds pretty clear and pretty believable. Half. Since you've been in business, do you feel like you've made a dent in that for your clients? And that number?
Not enough.
Has there been any improvement?
So we have been around for more than 10 years. We started out, I would say, with a solution that probably wasn't going to make a big dent in that number, because we worked with health plans to try to improve their nursing services for patients, which was fine. But as we got into really figuring out how to better fulfill our mission, we realized we weren't really going to fulfill that promise unless we worked with the people who deliver the babies. The OB-GYNs and the nurse midwives who deliver babies have to be fully supported to make sure they're finding out these risks that lead to maternal deaths, that they're getting feedback loops when people go home from the hospital and maybe they're spiraling into an infection that can lead to severe complications or death. So that's why we changed our model. And we not only changed our model to support those people, but also to work with health insurance companies to take in claims on the claims that you pay to that have all this data on whether people had various complications. We take those in to measure our impact. And we know that our solution is reducing rates of complications. It's increasing rates of healthy, normal deliveries, which should cascade into fewer complications and deaths. But again, the country as a whole is still going the wrong way, so we still have a lot of work to do.
Right. But relative, we're not talking about the whole country, but the clearly that your company has already saved lives.
It's hard to prove the absence of something. But the leading indicators would tell me that we are doing our part in partnering with our clinicians, right, to make them better at preventing these types of complications and deaths.
In every way possible. What are the top 3 maternal risks you're most focused on catching earlier, and why those specifically? I know we've discussed a ton of them, but just top 3, just to get a sense of.
So I would say the top 3 are: number 1, mental health, because it impacts so much in your outcomes. Number 2, blood pressure. We monitor at home, and a spike in blood pressure can lead to preeclampsia, other complications that really can cause early preterm birth or real complications for the mother. And the third one are what we call social determinants, but those other issues that keep you from getting good care because you, again, don't have transportation, you don't have a place to live, you got laid off, you need to file for unemployment. Those all really impact your ability to have a healthy pregnancy.
Love it. It's good to know. Just the more I feel like the more knowledge that we have about all of these topics, the better chance there is for change. So it's amazing to have you here when you know so much about. It's amazing to have you here when you know so much about all of these topics. It just makes it all feel more tangible. It makes change feel more possible to have this insight. So thank you.
I hope more change is possible.
Well, we're here because we believe that, yeah? Which of these are most preventable?
Of these risks?
Yeah, I feel like mental health is not it, but transportation seems like very preventable. Like it's a simple fix.
Yeah, I mean, the promise of healthcare is you're not going to mitigate the fact that someone is going to have hypertension during pregnancy. But the promise of healthcare is to prevent things that might be manageable risk and keeping them from becoming a risk that spikes out of control. So when I think about preventive health in pregnancy, people are going to have problems. They're going to have anxiety. They're going to screen positive for depression. Get them a therapist as soon as you can. Or if you're having a blood pressure reading, get that intervention. And so that to me is what prevention means in pregnancy is early risk identification and then prevention
Mm.
of it getting worse. If that makes sense.
Yes, that's really helpful. Thank you. What is the biggest misconception about maternal mortality in the US that healthcare leaders still don't fully understand?
I think people don't fully understand that a lot of it is preventable. You know, I mentioned over half the deaths could be prevented. And I also think they don't understand that it is not expensive to address this. That there are low-cost solutions using technology and virtual care coordinators and health navigators and the types of things we do that can really move the needle. And so I think that is the biggest misconception.
That's amazing. That's good news.
Should be.
Well, because you have a solution for it.
Mhm.
Wildflower. Leah Sparks.
Yes.
um, okay, we're seeing a growing shortage of OB-GYNs and nurses. When the system has fewer clinicians but a higher risk, where does Wildflower actually step in and close that gap?
It's a really important question. It is, we have a growing shortage of clinicians, and what we really aspire to do at Wildflower is to make those clinicians most focused on patient care in the most robust way they can and getting things off their plate that they don't need to be doing. So the example of we'll coordinate all of the things that you don't need to do in your office. The example of we take routine questions, right? We have OB-GYNs and midwives who spend 5 or 6 hours a week just answering questions on email, which is incredible service to their patients. But we can use technology, AI, validated content, non-clinical personnel to answer whether you can eat sushi or not. And that really helps take a load so that those clinicians do the things that only they can do, which is a lot and is really important to preserve.
That's incredible. That makes so much sense to have that kind of support. There's so many things that you don't know. Would you know nothing about it? So how would, if you've never done it or you don't have a sibling, or even if you have different, symptoms than somebody else, like um, from what I've learned from speaking with physicians, ChatGPT isn't the most reliable source for determining your next steps at this stage of the process when you're pregnant.
Yeah, at this stage, but it's what the consumers expect and they want instant answers. So, how do we enable the healthcare system to be that credible source of trust, but meet that consumer desire to know right away what I can do? And that's where using technology and being connected to these clinicians and creating an experience that is like a chat GPT, but from my doctor is really the what we are, I think, hoping to create as an industry and part of what we're thinking about at Wildflower.
And it sounds like what you're already doing. I mean, what I mean is that this is the perfect alternative. It's immediate, it's customized, and it's people that are educated in this specific area, which is very different than just a random chat that you don't know what context, they don't have context for your health, and these people have so much more context.
Right.
And the weight and the strain of the schedule for a physician to try to address everyone's like any question that they have would be just too much of a strain on their day. And what problems must remain human?
Well, obviously, we need real people to, like I said, to deliver babies. I think there is what I hope from technology and from
Depends on who
AI.
you ask.
What?
Depends on who you ask. Some people think in 3 years that's not a thing, and you think that will always be a
That a
thing.
human will deliver a baby?
That you won't need humans to deliver a baby in 3 years.
I don't believe that you will want to deliver a baby without a human there.
Yeah. Sounds really good to me to have a human there.
Think of it's really
Yeah.
good.
Yeah.
It doesn't always need to be a doctor. Nurse midwives do great delivery, and so there are. But my hope is that technology will actually increase the human connection as opposed to taking it away.
Mhm.
I
Yeah.
just maybe I'm old fashioned, but I really believe that part of um, health and buoying someone's how they feel, especially in something like pregnancy where you already feel so vulnerable, or anytime you're in the healthcare system, you feel vulnerable. I think it's going to be hard to really replace a trusted human connection. And ideally, those clinical providers and all the ancillary staff are better able to provide that because technology is taking away stuff that they don't have to do.
Yes.
Right. So, that to me is where I hope we end up.
I love that. I love that for us.
Mhm.
um, Pregnancy isn't just medical, it's physical, emotional, and nutritional. How do you support mothers across lactation, mental health, nutrition, and emotional care without overwhelming them?
Great question. So we do run a very hybrid solution where we are digital and technology first as a way to efficiently sort of support patients. Next level is these virtual care coordinators who can scale and survey a lot of patients. But the last piece where you're going is specialized non-clinical support. So lactation consultants play a really big role, especially postpartum with patients. And we work with 2,000 lactation consultants around the country in person in communities who can go to patients' home and support them postpartum with lactation and other issues, which is, again, part of this puzzle of whole person health in a very big way. Similarly with doulas and therapists, we have networks, even parent coaches. And the way we don't overwhelm is by, again, trying to use our technology and services and the data we collect to make those connections very personalized, right? And whether you want something virtual or in person, and getting those routed to the right people and the right different non-clinical specialists, if you will, is really what I think is important to make sure patients get what they need and not get overwhelmed.
Yeah, and I think this human aspect of having just the concept of being alone in your pregnancy and then, you know, having lactation challenges alone versus having someone come to your home, be nurturing, be supportive, explain that this is actually something that happens. You're not alone, and this is how we can get through this together. I mean, that's it's got to change the forecast of what that looks like for mental health after
Absolutely.
pregnancy as well. It has to impact that in a
Absolutely.
positive way.
And these things can't exist in a silo. Like a lactation consultant is trained on breastfeeding, but they can pick up that someone clearly is struggling with some anxiety or depression, and then what do? Again, Wildflower as a hub can then help them make a handoff so we can get that patient her mental health support. So these, part of what's happened in healthcare is things are very much in silos and they don't talk to each other. And again, the power of technology, and maybe the promise of AI, is to have smarter connection points and data sharing so that people don't get bounced around.
Smarter connection points is definitely the key to everyone having
Mhm.
better care. Um, when does this coordination, like, what's the biggest breakdown point where it's the biggest challenge? Is it educating all the clinicians that they have resources? I mean, how do you even begin to let them know that, like, if this is coming up, I mean, then in addition to them being a lactation specialist, they would also have to know how to interpret, you know, whatever others
Mhm.
offer other than mental health. It sounds
Mhm.
there's a lot of services.
Mhm. Mhm.
So, where does coordination usually write down when you're trying to get people to utilize all the services you offer?
Um, I think ironically, things break down if you ask people who work in the system, who are already busy, clinicians, even lactation consultants, if you ask them to do what I call hard behavior change versus easy behavior change. So, to ask an OB-GYN or a nurse midwife to change every question that they ask in every appointment differently is hard behavior change, right? They're busy, they have a way that they need to see their patients. Um, Easy behavior change is we suck data out of their EHR to know this patient has an issue. We're going to follow up with her and we agree on those working rules. So, what the trick that we have found of working in healthcare is it's a strapped system and you have to fit into the workflows and make it easy for everyone to adopt innovation. You can't ask people to do a lot of hard change. People don't have time. And so that is, I think, where things can break down. And what I've learned after working in healthcare for 20 years is fit within the way it works and make the innovation happen in ways that, again, it's easy behavior change instead of hard.
What would be an example of an easy behavior change that you've implemented that has
Yeah.
like increased your
A-
positive outcome?
After every first prenatal appointment, we set up data feeds with our practices where we get the patients, their demographics, any risks that they have, and all their appointments. So we know who these patients are, we can remind them of their appointments, we get them in our platform, we work in coordination with the practice, but the practice doesn't do anything different, right? But they know they're activating Wildflower in an automated way, and we're there for them. That's what I'm saying is figure out how to make things easy for healthcare to change. Um, doesn't sound very sexy when I say it that way, but that's kind of that is
It sounds like you're providing women with executive assistants,
it is.
which just sounds like a pretty great upgrade for compared to your average woman who's just sitting there all by themselves navigating this
Exactly, exactly,
silo.
exactly.
Silos that don't speak to each other. And then you have the weight of the interpretation of all the different silos, which is, I think, one of the most complex aspects of navigating any kind of system.
Right.
Is now in order to interpret the validity of what you're learning about your body and your mind, now you're responsible. And if you're not a doctor, how do you know how to navigate all of that information? So and also just talk about hard changes. It is a pretty hard change to suddenly give birth to a baby.
Yes, it's a major life change.
So it's nice to have an executive admin wildflower supporting you through everything, every step of the way. It's pretty incredible. Remarkable. I think a lot of women, including me, I wasn't aware that this existed. I didn't even know it existed. I mean, am I just an anomaly? Do you ever meet people like me in the wild that are just like in Zumba class that are just like, no, that's not a thing.
Um, uh, Perhaps. I don't
Maybe no, maybe not.
But I think if we do our jobs right, if you're in one of the regions where we operate, if you're in Las Vegas and you become pregnant and you go to your OB office for your first appointment, this is just part of what you get. And if we do our jobs right, this just becomes the standard of care. And if you've never had a baby before, why would you think it should be anything different? Of course, I have a health navigator connected to my OB-GYN office. Of course, I get this support. And I think that's what we should aspire for.
Definitely. I'll say that I in the wild has spoken with some women that didn't know that it
Mhm.
existed since I've just talked about having the
Mhm.
show. So I can tell you that I think it's been it's landed with the people that I've multiple people, women I've spoken to that have just and men
Mhm.
that have been like, I didn't know that was a thing.
Mhm.
There's a lot of people that don't know that this is available
Mhm.
to women. I mean, do you exclusively work with lower income women or is it
No, all people of all income
all
brackets
income?
have need support.
Yeah. Okay, well, even better. We started talking about your edge as a leader. After everything we've discussed risk, families, AI, trust what grounds you now when the responsibility feels heavy?
I think as it relates, I mean, obviously my family and friends ground me, but as it relates to work, what really grounds me is we start every team meeting with a patient case study that one of our health navigators shares of how they impacted a patient and supported a patient. And those, because it can feel very, very hard to change healthcare. And when you hear one story at a time from your team, people on the front lines, that is what's grounding and makes you feel like there is progress, right? One person at a time, one practice at a time, one state at a time, we can make progress.
I cannot wait to get into those with you. I am dying to hear those. They give me so much hope. And I just think it's incredibly touching the way you impact lives. I'm hearing from those individuals. It's incredibly meaningful. Thank you so much, Leah, for being here with me today and going over all the nuance of how Wildflower has this incredible impact, changing lives, saving lives, and making women's lives joyful at a time that could be incredibly terrifying.
It's great to be here. Thank you.
I'm going to ask you some speed questions.
Okay.
All right. Really quick before we go. What should every American know about maternal health in this country?
That it's not safe as they think it is.
Mm. Telehealth, game changer or overhyped for maternity care?
Game changer.
Game changer. Good, because there's a lot of it. If you could only change one thing in maternal care, what would it be?
I would have everyone have a therapist the whole pregnancy.
Genius. Totally agree, obviously. On a scale of 1 to 10, how important is investing in maternity care versus other parts of healthcare?
8.
Mm. Okay. Are things improving, declining, or standing still?
Standing still.
Hmm. True cards. What gives you the most hope right now?
That the system isn't sustainable and has to change.
I'll say it again because I just need to hear it again. What gives you the most hope right now?
That our system has to change, and it will change because it's not sustainable the way that we're doing it.
I love that. I love that. Thank you, Leah. Thank you.
Thank you.
Thank you.